My name is Dr. David Benversi, and let me share with you how our spinal decompression therapy can help eliminate a disc herniation or a disc bulge and essentially help you reduce your chances of having surgery in that area. Now, first off, let me tell you a little bit about the surgical consult or the surgery itself. In some situations, surgery is necessary and an effective treatment for what you might be experiencing. However, we're going to talk a little bit about first the mechanisms of how that disc herniation or disc bulge gets there, and then the final steps before we would need to essentially consult a surgeon to do that. So typically, as far as our disc bulge or disc herniation, we have discs which are in between each set of bones in our back. Now, those discs are made to more or less absorb some of that pressure, the shock absorber between those two bones. Now, if that pressure is not applied evenly over that entire disc, sometimes those discs will give out in certain areas and basically become a disc bulge or a disc herniation. Now, when that becomes important is when those disc bulge or disc herniations start to encroach on that spinal canal, which is where our spinal nerves are being housed or where they're going through at that point. Now, as far as some of the symptoms we would experience with this is we're going to probably have some pain or discomfort in that area. We'll possibly have pain or discomfort going down into the legs. We'll have numbness and tingling in the legs. And we can even have, in severe cases, a decrease in the muscle strength and control of those muscles in the leg. Now, typically when we talk about surgery, the main thing that we are trying to help or treat with that surgery is neurological deficits. And what I mean by that is typically when it gets to a point where we don't have any, or we no longer have control of bowel or bladder function, or sometimes in the severe stages of those symptoms going down the leg, that's when we're going to have that severe neurological deficit. And those are normally confirmed or backed up by studies that are basically your nerve conduction velocity test and also your electromyograph, which is basically going to measure the impedance of that nerve or the signal of that nerve and how strong that is going through that area. So that's basically the reason or the time frame of when surgery is necessary. Now, there is also a time frame before we get to that point that is very essential, and that's what we can help out with as far as avoiding that surgery. Now, just because you have the symptoms as far as the pain, the numbness and tingling and burning going down into the legs, that's not necessarily a prerequisite for the surgery. At that point, we are typically still something that can help you out as far as eliminating that disc herniation. Now, let me tell you a little bit about how our therapy works and how that eliminates that disc herniation. In our therapy table, basically what we have you do is laying flat on a table, and we secure the lower part of your body and the upper part of your body, and what the table does is it basically helps distract or pull those two bones apart that we were talking about before, above and below that disc, and effectively creates a negative pressure in that disc. So that disc is going to want to sort of suck back or go back to where it was supposed to be or where it originally was. And in addition to that table more or less pulling those bones apart, it's also going to slightly flex the lower part of your body, thus enhancing the therapeutic effect of creating more of a negative pressure and causing even more of the disc wanting to go back to its normal shape or normal condition. So in those situations, we can effectively reduce the disc herniations and disc bulges, and we can also help you out with those symptoms we were talking about before, as far as the leg pain, the leg numbness and tingling, and sometimes even the neurological effects as far as the decrease in the muscle strength and the coordination in those muscles as well. So if you think you're experiencing a disc bulge or a disc herniation, we'd love to help. Give our office a call at 618-519-9334.